And today is World Purple Day. It's a time to spread awareness about epilepsy. Epilepsy is a disorder that causes seizures. Joining me this morning to talk about some common misconceptions is neurologist Jay Gavala and neurosurgeon Nitin Tandon, both with UTHealth Houston and Memorial Hermann. Thank you so much for joining me. First question is, are all seizures related to epilepsy?
Maybe I'll start by saying thanks for having us. So people can have seizures, but not all seizures necessarily translate to epilepsy. And so there's a couple different ways that can translate. You can have 2 or more unprovoked seizures or a single seizure that then, with certain risk factors, suggests you have a recurrence of future seizures, which then imparts the diagnosis of epilepsy.
So that Dr. Gavala, just since I have you talking on that, are there other misconceptions that people have about epilepsy?
Oh, absolutely. So one is just the occurrence of them. Quite a few individuals actually have epilepsy in a lifetime. 1 in 26 individuals will go on to have epilepsy. 2 is the actual symptoms associated with epilepsy. Individuals may think of whole body convulsion movements as being a seizure, but seizures can have a variety of different clinical symptoms. They may include staring off into space, sensory symptoms, motor symptoms, or unusual behaviors.
Yeah. Dr. Tandon, I have worked with you on stories before about surgeries that can help improve epilepsy. Have you found anything that you find you could classify as a cure for seizures?
We hesitate using the word cure, but the practical nature of epilepsy surgery is that there are about 70% or so of patients who, after successful epilepsy surgery, don't have seizures again. They are sometimes still on medications, but there are also individuals who are off medications who don't have seizures anymore. So that's as close as one could get to the word cure. But we hesitate using that word because it's not like a like a tumor or something else that you could say it's gone. It could never ever come back again.
I know, but journalists would prefer you to use that term. So I had to put it out there. What would it take for a patient to qualify to have a surgery for their seizures? And how much could you possibly improve their symptoms?
So as Dr. Gavala just said, there's a variety of different types of seizures that individuals have, and there are certain types of those seizures that are focal, which come from one spot in the brain. And it's those individuals who have sometimes the hardest time controlling their epilepsy with just medications. And in those cases, we often do a variety of tests, an MRI scan, a magnetoencephalogram, and then occasionally the implantation of probes in the brain using the robot that you were just showing a little video of to pinpoint where the seizures are coming from. After that is done, we could pass a small laser fiber into the brain and destroy it, again through a tiny little incision so the skull is never even opened, or through a small operation where area of abnormality in the brain is actually physically removed. And more recently, in the past, especially the past 6 or 7 years, there has been a huge resurgence in the use of electrical stimulation of the brain or neuromodulation of the brain to try to control epilepsy. And there are many new devices and many new approaches in that arena as well. Again, no removal of brain tissue and a high control rate in many instances of seizures.
Yeah, I mean, it's such a relief for some people to have a procedure done like that. But Dr. Gavala, are most people with epilepsy destined to have some kind of a brain operation like that, or do medications work well for most people?
It's a great question. With a single medication trial, about 50% of individuals will have complete control of their seizures. However, if you don't respond to that first medicine, the chances get lower and lower that you will respond to subsequent medication trials. At the end of the day, about 1/3 of individuals do not respond to traditional medication therapies, and it's those individuals that we really focus on our pre-surgical and surgical workups.
Do we know what causes epilepsy?
So there's a lot of different components to that, and I'm not sure there's a real simple answer. So there can be a lot of variety of reasons. It can start from actual abnormalities within the brain tissue itself. That could be something that is acquired. Perhaps there was an infection, a stroke, a brain tumor. It could be something that someone was born with. There can be malformations of the brain tissue itself. And then in some cases, there is a genetic contribution, and we're learning more and more about those genetic contributions, and those can be very diverse in their etiology.
So not all epilepsy is diagnosed in childhood. Sometimes it can happen later in life because of one of the factors that you mentioned?
Oh, absolutely. In fact, there's commonly a bimodal distribution where there's a large peak initially early on in life for individuals who develop epilepsy, but then a subsequent peak later on in life in adulthood of a new population of individuals who acquire their epilepsy.
And before I let y'all go, Dr. Tandon, is there anything that you'd like people to know? Because a lot of people who maybe don't respond well to medication think maybe that's the end of the road for them. But when should they be consulting somebody like you for further treatment?
So a lot of individuals, just like you described, are seen by neurologists or by community practice doctors, and they feel like there's nothing else that can be done. There's frustration, there's sometimes a lot of emotion attached to the disease itself. And we strongly recommend that they come and see one of my colleagues for a second opinion, like Dr. Gavala and one of his partners, to determine if they have a focal epilepsy that could be surgically treatable. Certainly, if someone has failed 2 medications at good dosages and continues to have seizures, they should be referred for epilepsy surgery. I just want to get the message out there that, people shouldn't have to continue to live with the burden of this disease. There are many, many, many therapies that are available to them. Many of them do not include cutting the head open, and folks are sometimes scared of that idea.
Yeah.
And we've spent a lot of effort and energy over the last 2 decades here at UT at the Comprehensive Epilepsy Program to try to make epilepsy care much more tuned to the needs of the individuals of our population. So we really. It's a passion for us, and we'd like to be able to provide more care to more people.
Yeah, well, you two have certainly been part of the reason that the treatment for epilepsy has evolved. So we appreciate having you on this morning, this World Purple Day, to continue to raise awareness about what's out there, the options for people with epilepsy. Dr. Jay Gavala and Dr. Nitin Tandon, we appreciate your time.